Let's rapid fire some red flags that your patient might be deteriorating. Med-surg nurses, tele-nurses, nurses outside of the ICU play such a vital role in monitoring patients and communicating with providers, and early recognition helps improve outcomes. This is not a fully comprehensive list, but these are some things that come to my mind and definitely things that you should be taking a look into. Number one is increased work of breathing. Is your patient breathing hard? Is their respiratory rate increased? Have they gone up on their oxygen requirements? What do those lung sounds sound like? Have they had a recent ABG or chest x-ray? Number two, tachycardia or tachyarrhythmias. Does your patient have a fever, pain, anxiety, or some other reason for why they would have an elevated heart rate? Anytime a patient has an abnormal heart rate, whether it be high or low, my next thought is, what is their blood pressure? High and low blood pressures are red flags in and of themselves. My next thought is, are they symptomatic? We should also be going back and looking at our patient's vitals and identifying any trends in their vital signs and if this is a change or if this is on par for this patient. Another red flag that a lot of nurses miss is low urine output. The kidneys tell us a lot about how a patient is doing. If they are not putting out adequate urine, sure, they might be dehydrated or their kidneys might not be filtering through things very well. And if the kidneys are not filtering very well, we're concerned. Any urine output less than 0.5 milliliters per kilogram per hour is definitely something you should be notifying the provider of. Another red flag is increasing lactic acid. If your patient had a normal lactic acid and now their lactic acid is 2.8 and you're like, oh, it's not that high. Why is their lactic acid high? You might know the answer, you might not, but definitely warrants investigating a little further. Jumping back to blood pressure really quick. Hypertension and hypotension both are red flags. If the patient is hypertensive, my concern is strokes, bleeds. When a patient is hypotension, my concern is perfusion. Are they hypertensive or hypotensive for a reason? For example, maybe your patient's in 10 out of 10 pain, so they are hypertensive. We can treat that. Maybe they take blood pressure medications and they just haven't been restarted in the hospital. For your patient that is hypotensive, maybe they need some more fluid. Maybe they have hypovolemia from blood loss. Maybe they have sepsis going on. Your organs are not very happy and not perfused very well when you are hypotensive and your MAP is less than 65. Another red flag are any neurostatus changes. This could mean your patient goes from being calm to super agitated, from calm to super sleepy. Maybe they have pupil changes, sensation changes, motor movement changes, speech changes. Anytime a patient has any neurostatus change, the first thing I want to check is a blood sugar and typically an ABG, and also doing a more comprehensive neuro exam. Now remember, anytime you see any of these red flags, it definitely should warrant either a call to provider or a rapid response. These are just some things that I thought of up at the top of my head. Let me know if you have any questions.